It's 2019.
Okay, and do you know when your birthday is? You don't have to say
Yes.
it. You do know when your birthday is. Okay. So the patient is awake, alert, and oriented times 3 to person, place, and also to situation. She seems to have a very happy affect, and her mood is appropriate for the situation. Okay, so the first thing we're going to start by doing is inspecting the hair. So we've got, the hair is about medium length. It's brownish blonde in color, evenly distributed. I would palpate the scalp for any lesions or to make sure that there are no parasites, i.e. lice, and I don't see any of that. The hair texture is fine, it's clean, it's well maintained, and her head is normal cephalic. I'm gonna look at her facial features. I see that her eyes are in the upper third of her face, her nose is midline, and that the mouth is in the lower third of the face. And it's bilaterally symmetrical, so everything looks to be in order there. The first thing I'm going to do is also assess the ears. So I'm just going to take a look at her ears, going to look sort of just a gross examination and assessment, looking at the outer auricle of the ears, making sure that it has good elasticity. If I had an otoscope, I'd be looking inside the ears, making sure that there is no foreign bodies or any redness or drainage. I'd be looking to see that that tympanic membrane is a pearly grayish color and convex in shape, and I will pull the ear up and out to be able to visualize that. I can see that the patient has bilateral piercings on both sides. She's not currently wearing earrings, and I will be assessing, again, putting the ear up and out to assess and look inside of her ears and look for any drainage or any cerumen or anything that would indicate that there's something unhealthy about the ears, and the elasticity on both sides is good. Next, we're going to take a look at her eyes. The patient is wearing glasses, so we know that she has some corrective lenses. If I was doing an eye assessment, we would use the Snellen eye chart, but in this case, the patient does have glasses. I'm also going to be just making a gross examination of the eyes, looking at the sclera. The sclera are bilaterally white, and her eyes appear to be moist. There's no excess drainage. The conjunctiva, if I was to pull down her eyes, I would see that they're pink and moist bilaterally. I don't see any extra redness or tearing of the eyes. Are you feeling any eye pain or eye sensitivity?
No.
Okay, if I had an ophthalmoscope, I'd be looking into her eyes and basically looking back there for the, I'd be looking at the vessels in her eyes, also making sure that I don't see anything with the optic nerve and the optic disc, and looking at those structures in her eyes. I also would be shining a light in her eyes to make sure that her pupils are bilaterally equal, round, and reactive to light, and that they accommodate and they open and close upon the light shining in them. So unfortunately I don't have a pen light, so what I will do though is have the patient follow me with their eyes to make sure that their cranial nerves are intact. So if you could just follow my finger with your eyes. Okay, and the patient is able to move their eyes in all directions in relation to eye movement. Okay, the next thing that I'm going to do is just take a look at the nose, and I'm going to look in the nares, and I'm looking for patency to make sure that both nares are open. Could you just lift your head for me a little bit? And she doesn't have a deviated septum. There doesn't appear to be any crusting, drainage, or lesions around the nose. Next, I'm going to look at the mouth, and the mouth is pink and moist. There's no lesions. I don't see any cracking or dryness around the corners of the mouth. And if you'll open your mouth for me and say ah. Okay, so I'm going to be assessing the uvula and also the tonsils. Ma'am, did you have your tonsils removed as a child?
No.
Okay, so she's got both bilateral tonsils, and we would grade those. I'd probably grade them around a 2, and the uvula is midline. I see that the rugae of the tongue are there. The top of the tongue has a rough appearance. With normal moisture, the tongue and the mouth and the mucus and the mucosa are all moist. The patient does have a full set of deciduous teeth that are in, and also, if you open again, I can see that there's been some cosmetic repair in terms of having maybe some fillings or bridge work or dental caries filled, correct? Okay. So then next we're going to move on to the neck, and we're going to just assess the neck. Are you having any pain in your neck?
No.
No, not having any pain, okay. So I'm just gonna feel along the neck, and I'll actually, while I'm feeling along the neck, have you just kind of move your neck from side to side. And the other side. And if you could please lean back and then forward. Okay, the patient has full range of motion in the neck. And while I'm here at the neck, I'm going to do an assessment of the lymph nodes. I'm sorry, so I am going to have to touch around your ears and your face.
Fine.
So we'll do pre-auricular, post-auricular, mastoid lymph nodes, tonsillar, submandibular, supraclavicular, anterior cervical, and also superficial, actually deep lymph nodes. And so we're just making sure that they're mobile, they're non-tender, and that they're not swollen. Are you feeling any pain while I'm palpating any of these parts of your
No.
body? Okay, great. So while I'm here at this area, I'm also going to go ahead and assess the facial sinuses. So I'm going to touch those maxillary sinuses and assess those for any tenderness or pain. And then also the frontal sinuses. And do you feel any tenderness or pain there?
No.
Okay. So the next thing I'm going to do is I'm going to kind of do an assessment of the peripheral vascular. I'm going to take a look at the patient's hands. And while I'm doing this, in every area of the body, I'm also assessing the skin, the turgor, the temperature. I'm going to use the back of my hands to compare. And the patient is actually relatively warm, even with short sleeves on. And that's on bilateral sides. The skin is soft and smooth. There's no crusting or scaling. I don't see any lesions. The patient is fair skinned and does have freckles. So if I saw anything that was abnormal, I would be looking at the lesion and assessing for the A, B, C, D, and E. And that would be asymmetry, borders, color, color, also the elevation, and the D is escaping me right now, so we're going to move on to something else. So while we're looking at that, I'm also going to check out the nail beds. The nails are clean and manicured. The patient's capillary refill bilaterally is less than 3 seconds, which is normal. And we're just going to check the other side of the hands, and everything appears to be fine there. Okay. I'm also going to assess the brachial pulses the radial pulses while I'm here. And they're equally strong and bilaterally palpable. And I can also do the brachial pulses while I'm here. And they're also equally strong and bilateral on both sides. Returning to the neck, because I'm going to assess the lung fields next, I'm also just going to go ahead and assess the carotid arteries. So ma'am, if you could turn your head in that direction and hold your breath for me. I'm going to be listening for any bruise or any sign that there might be some sort of blockage of the carotid arteries. I'm going to do one at a time because I don't want to inadvertently stop any blood flow to the brain by doing that. And I'm going to use the bell of my stethoscope. And hold your breath for me while I do that. And if you'll turn towards me again and do the same thing on this side. Okay, so I'm not feeling any bruise or anything like that in the bilateral carotid artery assessment. So we can move on to the, we will go ahead and move on to the lung fields. So we're going to be listening in 10 areas, 10 in the front, 10 in the back, and on both sides. We're going to be making sure that inspiration is longer than expiration. Going to be listening to make sure that there's no adventitious sounds, no stridor, and that the patient doesn't have labored respirations. So first thing I'll do is if you could just lean up for me. I'm going to have you say the word 99.
99.
Again.
99.
Again.
99.
Again.
99.
Okay, so with that, I'm checking for tactile firmitis, making sure that I'm not having any vibrations when the patient is saying an audible word, and I didn't feel any of that. So now I'm just going to go ahead and listen to her lungs and make sure that I can hear breath sounds in all fields and that I don't hear any adventitious sounds. And you can just kind of breathe deeply for me. your sides. Okay, so no adventitious or abnormal breath sounds heard on assessment. Didn't hear any crackles or rails or anything that indicated that the patient has any issues with respiration. So now I'm going to do a cardiovascular assessment. I'm going to be listening to the heart in several areas. Actually, for me, it's probably better if I stand on this side. So first, I'm going to listen at the aortic, which is in the right sternal border, at the second intercostal space. So let me listen there. This is your right side. Okay, now listen there, and then the pulmonic, which is going to be in the left sternal border at the second intercostal space. And then on the herbs point, which is at the third intercostal space, left side. Tricuspid, fifth intercostal space. And then the mitral valve on the fifth midclavicular line. Okay. And then we're going to listen to the apical pulse for a total of a full minute. And the patient's heart rate today for the apical pulse was 75. And also I forgot to state at the beginning of the assessment that the patient had a blood pressure of 145/79, heart rate at that time was 75, temperature 98.7, and respirations were 16. So then for the rest of the assessment, we're going to do a abdominal assessment. So the first thing we're going to do is, before we touch anything, we're just going to do a gross inspection. We don't want to do any palpating, because once you palpate, you can actually make the bowel sounds hyperactive, and we don't want to have a false reading of what the bowel sounds are. So we're going to just look first, and everything seems to be normal upon assessment. There's no bulging. The patient, do you have any pain or tenderness in your abdomen?
No.
Both sides are symmetrical. I don't see any masses or lumps. The next thing that we'll do is we'll also